nothing was there.
Okay.
Reactivating it.
I know, look at that.
Exciting.
Did the water flush out any questions? One of the things that I'm hoping to aim at here is the ongoing development of finer skills of understanding and assessing one another's chi. So I ask, you know, in assessing, in using these understandings that I've just been talking about chi, to assess a person's chi, what do you do? What do you look at? And the first, maybe not the first, but one of the early aspects of the individual on which to focus to gain an appreciation of the state of their chi is their posture. How upright is the person's body? If it inclines off the upright, how and why? One of the most fundamental characteristics of the human being is that we walk on two legs. Most vertebrates use four. Our development as Homo sapiens is inextricably linked to the shift from four-legged to two-legged locomotion. This brings the head top, the length of the body, up above the ground. It permits seeing into the distance. When you walk with your spine parallel to the ground and your four limbs touching the ground, your face and your eyes are looking down. You have to hold your head up in order to get the outward view, which is really the forward view. But when you rotate this 90 degrees, suddenly the visual field is vastly expanded. Well, what happened in human biological evolution consequently was the development of a mass of neuronal activity and tissue to process all this information that was coming from the visual. And led to the development of a hunting strategy which consisted of picking up rocks and using them as projectiles, picking up sticks and using them as a way to project force. These things require the coordination of the eye and the hand. And the parts of the cortex that later developed into language centers probably began and proceeded in an evolutionary sense in response to this need for greater hand-eye coordination. All of this hinges on and depends upon the capacity to maintain the uprightness of the body, which up until the present remains a key aspect of well-being. I can tell you from personal experience, when your capacity to remain upright is challenged, it threatens you. It doesn't threaten you in some philosophical sense. It threatens you immediately, right now, and teaches the importance of understanding the integrity of the upright body as a primary way of measuring the well-being of the individual. So, even before I make the acquaintance of a patient, I see them. How do they move? Are they upright? Are they comfortable? All of this I understand as a way of looking at the patient's chi. Like I said, are they inclined? Are they bent? Is the straight line broken in some way? And if so, what's influencing this? That idea clear? Well, just as the whole body has this upright or not determination about it, any part of the body similarly has its uprightness or its correct chi. Every joint, from the smallest to the biggest, has a correct chi. The correctness of this chi enables it to manifest the connected potential to communicate, to change, to move in the normal rhythm. And here it's important to point out that one of the amazing things about the body is the extent to which it's self-regulating, self-correcting. Most of the people who walk into the clinic, regardless of what they are dealing with, will be better in about 7 or 10 days. And I would say this applies to about 70% of the patients who walk in. They'll be better if you give them a cup of water. They'll be better if you give them acupuncture. They'll be better if you give them herbs, if you give them tuina, if you give them moxa. If you do nothing at all, they'll be better. Because the body tends to repair itself. and it tends to regulate itself. So what we do under the guise of medical intervention is not to do something to the body that it wouldn't normally otherwise be doing. All we seek to do is to, if there's something that's inhibiting the body's natural tendency to self-correct and self-regulate, can we do anything about that? Is there any way that we can adjust through the use of needles, through the use of herbs, through the use of hands-on, through the use of warming? Anything we can do to regulate the body according to the particulars of our diagnosis. But the point is that the body is highly self-correcting. One of the problems that patients tend to have with modern medicine is that it focuses so much power on different aspects of the body that in solving the problem that it undertakes to solve, it wipes out big chunks of the body's self-regulating capacity. You know, a kind of typical example of this is chemotherapy in treating cancer patients, where highly toxic drugs are administered that do indeed kill the cancer cells, but they kill a lot of other cells as well and destroy a lot of tissue and a lot of function of the body. Well, this is one of the ways in which Chinese medicine tends to kind of shine by comparison, because in the age-old admonition to the physician, do no harm, it's much less likely to be harmed by an acupuncture treatment than it is by a round of chemotherapy. Of course, it doesn't do what the chemotherapy does. So it's important not to get into a false comparison. And I use that example only to illustrate this one feature of Chinese medicine that's far less, I guess we can use the word invasive. So to get back to this notion of assessing the correctness of the qi in the body, one of the things that happens to the body as you live your life is that it encounters forces which oppose it. Some of these forces we call viruses or bacteria. They result in infection and disease. Some of them are impact and injury and results in wounds and other kinds of trauma. All this is, categorically speaking, not disease. It's par for the course. One of the things that you want to examine in your patient is how is the body, how is the person responding to such insults? In other words, one of the ways of understanding the correctness of a patient's qi is to observe and understand how is the body changing in response to the contrary forces that it encounters. And is that body's pattern of change adequate? In other words, do you need to do anything? So each and every joint has the correct qi. In Taiji, we talk about the 9 gates. The 9 major joints are the wrist, the elbow, the shoulder, the ankle, the knee, the hip, the iliosacral union, the occipital cranial union, and the head top. These are all joints which over the span of a lifetime of practice in Taiji, you begin to enhance your capacity to open and close these joints. There's no shortcutting this process. It's a process in which a person must invest themselves over a span of time. When the patient presents in the clinic, whatever momentary thing has happened, you have this long-winded process of coming to I'm searching for the right phrase, realize the potential of the body environment. One of the reasons why we establish our clinic in the way we do, which is kind of in more ways than one sort of centered on the Taiji class, is to provide a place for people who want to pursue well-being to explore those self-regulated, self-controlled dynamics that form the substance of the Taiji class. Now, it's true that most of the patients, maybe they get interested, maybe they come once or twice, but most of the patients in the clinic have not become Taiji students. So you can think of that relationship as a kind of hopefulness on our part. But this kind of development takes time. I've long had this consideration that if the process of cultivation that is suggested by the nature of the study of Taiji is progressing, then the class will grow. The class will open and more people will come in. In other words, the thing that I can do to enhance this dynamic of the clinic and the class itself is simply to do the class. and to work as diligently as I can to keep the class on the path of developing a cohort of people who actually pursue this kind of Taiji development. And what we're doing, in some simple way of putting it, is simply enhancing the quality of our movement. Life depends for its continuation upon movement. And the quality of life, lo and behold, is not dependent on how much money you have, but how well you move. There's something everybody can do, regardless of any kind of consideration of who they are, or where they're from, or what color they are, or what gender they are. But anybody can do to enhance the quality of their survival. And that's increase their capacity for movement. So this is another way of thinking of the analysis of a person's chi. In the same breath that you look at their posture, you look at their movement. How do their joints currently move? If joints open and close easily and in the normal, expected way, then this is a good report about the chi. And if there are problems, that's where you'll see them. So, uprightness, movement. Another factor that's quite visible in people and is a direct reflection of the state of chi is color. You know, one of the aspects of five-phase theory, five-element theory, is the assignment of an associated color to each of the organ systems. You know what they are?
Are you talking to me?
Anybody?
Are the lungs white?
The lungs are white.
Liver's green.
The liver is green.
Heart red.
What?
I was just saying at the same time she was, the heart is red.
The heart is red.
Yes.
Liver's green.
The liver.
The spleen is yellow. And the kidney is black. Now just quickly look around the room and look at everybody's face. So what you should see, what you can see, is that in one sense we're all the same color, but in another sense there's a kind of spectrum of light and dark. There's a spectrum along those five axes that we just named of lighter and darker. In other words, more yellow, less yellow, more black, less black, and so on.
Like some are
easier than others. Like white, like sort of like that seems easier, or red, but it kind of get lost with like green or yellow, I guess, maybe, or black even.
Would you use the eyes in that diagnosis, or would you?
Would you look at the color of the eyes?
Mm-hmm. Because I do.
Yeah, I look at the color of anything that I'm looking at.
Uh-huh.
Did you want to say something?
Oh, it's just vague. That's fine.
Vague is okay.
I'm just saying that when I look at people, I feel like I have a sense of redness, and I feel like I have a sense of white. But like green and yellow and black are harder for me to like see in someone's like skin or eyes or whatever. Like I don't know how that would present, I guess.
One of the cool things about working in Chinese hospitals for years is you get to see a lot of patients. And when you've dealt with a few jaundice cases, you come to understand what the yellow color looks like.
Yeah, I've seen that.
And on a ward specializing in the treatment of liver cancer, you see green people.
Like adrenal fatigue, you see like the dark under the eyes. You see that?
Yeah,
Black.
the manifestation of kidney pathologies is pretty visible.
Hi.
You need us to be out promptly at 2.
It's also possible that I could just have that person upstairs and put the next person down here by 2:30.
Okay, we'll get out on time.
Okay.
What time is it now?
142.
Okay.
Yeah, sometimes you see like in different parts of people's faces, there's just like a faint hue of a color.
This is helping. It makes sense more now, like, because I'm like, oh, I have seen that once you mention it.
There's also a kind of, I hesitate to use the word, but aura. People have a kind of color to them. Or people can have a kind of coloring, or their glow has a certain look, color, I don't know what to call it.
Yeah, that makes sense. It's just like you're perceiving the most subtle manifestation of that color.
Right.
But even like if you look at cartoons, like when the character gets sick or like, you know, has a stomach ache, they turn green, or it's kind of funny.
Do you train in Chinese medical diagnosis with any techniques like looking at a candle? I mean, there's ways that you can train to see an aura more. Does traditional Chinese medicine do any of that kind of diagnosis?
In a general way, yes. I mean, definitely the traditional approach to training emphasized the cultivation of the perceptual capacity. Not necessarily specifically learning to see auras, but learning to see. If you learn to see, and there's an aura there to be seen. Somewhere along the line, there's an intersection of those two capacities.
The facial diagnosis is pretty, there's a lot there, too.
One of the main ideas in Chinese diagnostics is the notion of zang shang. Zang means internal organ, viscera. Shang means manifestation or appearance. This idea is that one can perceive the internal state or the state of the internal body by the observation of the external manifestation. So that what one sees on the flesh is, in fact, a manifestation of what's going on in the interior. This was incredibly important in a day and age where there was no other way of getting information from the interior. You could listen, but the expressiveness of the body is rather limited. In his famous Book of Five Rings, the great Japanese swordsman Musashi wrote a piece of advice which is relevant to this discussion. Pay attention to everything, even to trifles. One of the things that I've found remarkable about Martin, my Taiji teacher, is that to some extent his diagnosis of people is based upon the way the fabric of their clothing lies on their body. As a very subtle expression of that zang shang, external manifestation of the internal organs.
That's interesting. What's like an example of?
Well, I can think of I'm remembering one patient. We were looking at this woman's back. She was fully clothed, and he was pointing out the way that her jacket or blouse lay across the kidney, and just pointing to this ripple, little fold in the fabric which was otherwise unexplained, and correlating that to a known fact about her kidney. Similarly, I remember an instance of a similar kind of observation of a patient with a spleen disorder made on the front lower left part of her abdomen. I don't have a... Yeah, exactly. Elementary. Are there particular issues or questions that any of you have about the meaning or use of qi, either in the class or in the clinic?
No, but I have a question about something you were talking about earlier.
Yes.
You were talking about how the body corrects itself, and then made me think about how people's bodies adjust to their patterns and their habits. So like when someone gets, has an injury, their body like kind of changes its balance to sort of like protect itself and like finds like new balance. But it's like might be out of sync with the Tao or with nature, but it's like self-regulated to a situation that, in order to survive, it has to, like for example, my cat broke its leg and its whole back twisted up. And I would have to like do massage, but then that's how he was able to, move through the world, was in this new configuration.
Yeah, it's a very important question. I would say that upwards of 80% of what people struggle with in the aftermath of even traumatic injury is the consequence of their compensatory changes. The damage, in other words, that we do to ourselves in coping with the damage that we experience from other sources. This is kind of subsumed in that category of chi analysis, which I referred to earlier as, how is the body adjusting to the forces with which it comes into contact? Because it's constantly going through these kinds of unwanted intersections. And how does it come out of these things? Eventually we're engaged in a fight which eventually we all lose. So one of the markers of success in this battle is, how do you lose? But it's very important, particularly in understanding the posture and the gait. These dynamics that you bring up about the changes that we put ourselves through in order to deal with factor X, Y, or Z, whatever we're... Did I just restate your question, or did I respond?
No, you elaborated on it, which is good.
I was thinking, and I don't know, I could relate to that too, but I would love it if you could talk something about one person trying to affect someone else's chi. We kind of talked about how the body is self-regulating. It works on its own chi. But what happens when one person tries to, which is like what's happening in the clinic, one person trying to affect someone else's chi? Like, what's going on there?
Yeah. Everyone understand your question? By far, the largest fraction of the total trying to affect another's chi is contained and conveyed and accomplished through listening. What is the most potent thing that you can do if you want to affect another person's chi? Receive it. Listen to their story, take their pulse, feel their body, understand the information that they're putting out. How common is it in your life that other people understand what you have to say, to experience, to feel? I would say that for most people it's relatively rare. one of the things that makes the practice of medicine what it is the need for this. Another way of saying that is that the power of the clinic lies in the moment of, listen to the word, connection. When the practitioner and the patient establish it. What do we do that regulates another person's chi? We give it some place to move to. We establish ourselves as actual bona fide receipt points of what is emanating from the patient. This is why it's so important to develop the capacity to listen with your hands. So that when you put your hands on people, you're not telling them something, but you're letting them tell you something. That even when doing something with your hands, you don't cease listening to what the patient has to say about that, even wordlessly. This, in my experience, is what makes a treatment successful, efficacious, beneficial, possible. You know, long before there was medicine, there was touch. Before there was language, there was touch. You see, this is a behavior that animals manifest, all kinds of animals. When one is hurt, the others lick it, stroke it, rub it, nudge it. Yes.
If we're going to be out of here by 2, I need a few minutes to get all this stuff out of here.
Are we at that point?
Well, it's 2.
157.
Oh, okay. Thus endeth